heights and everything you need. There is a hook that this goes on. Yeah, there's a hook on for the control. Yeah, it's on one side. Which side is it? Well, slide maybe for this side.
Little thing.
Yeah.
Yeah, I feel it. Yeah.
Here we go.
The scar.
I know. Alright, cameras on?
Yep.
Good. Everybody's ready? Nope. What I'm doing is just trimming.
They could turn around and see.
Wow.
Amazing. Wait, it's not too much? Wow. Can I have a trash can over here? Just makes it easier.
Looks good.
Can we have a trash can right here? No. I'm gonna go all the way across at the same level. I just wanted to measure. Now what we're doing is called a hidden transplant. The reason I'm cutting hairs in this shallow or this short is so this will cover. This way he doesn't have to worry about anyone seeing what we've done. Right? So we're going to be limited to what we can harvest today because of the areas where we're going to harvest. Because of the scar tissue that we have before and because of the limits of what he needs to do this week, we're going to have to try and hide everything for him.
Elections, don't worry, doctor. Whatever you want to do.
You know, I mean,
I'm
we
okay.
can.
Yes, do whatever you wish to do. No complaints.
I think
What
we
I
should
wish would be shave everything.
Yeah,
Okay.
shave it. He's saying okay, no?
No, I'm okay
You're
with
okay with
everything.
that?
Yes,
He's okay
I'm
with
okay.
that.
I'm not doing it every day.
Here's the thing.
You it?
You know, if I shave all of this, you're gonna have strip scars that are all the way around. You're gonna see the pit scars and
It's
everything.
okay.
You want to go shave ball down to zero, nothing.
It's okay. It's
Okay.
okay.
Make sure you understand this.
Okay.
I'm talking about shaving your hair down shorter than mine is.
Okay. No, I understand. I realize.
Yeah.
It's not going to look great for a week or two, and then. Yes, but at least.
Consider necessary to
For
shave it
the
all, do
temporary
it, but
baseball
if it's not
transplant.
necessary, don't do it.
That way he can
Yes.
have more hair transplanted.
You're getting Brazilian.
Right, Brazilian boxing.
Brazilian
We're gonna do that.
Wow.
Yes.
We're gonna do that. Then let's do this. Let's just
Yes.
open up everything we have underneath this crown, underneath the scar area here. That way we don't have to worry about shaving all of this. You don't have to worry about having to wait 6 to 8 months for all this hair to grow back in.
Okay.
Let's take this area underneath. This will give us plenty of room to focus here. We'll pull a hidden area here also. And that'll give us plenty of room to do training and get you guys set up so we can get some grafts. It'll also keep all your scars hidden back here, so it'll be a 10-day bad haircut for you as
Okay.
opposed to a
Sure.
6-month bad haircut
Right,
for you.
right.
Okay? Just trying to make sure you have an easy transition back into life. So we'll do this. And this will actually open up quite a bit of area for us to do this and actually works really well. So, I'm purposely shaving this down here. I'm going to shave down first, just so we can get the area that I want. Yep, perfect. I love that you know that trick, Doc. Hey, may I have another chocolate? So that'll give us a good area that'll actually mark everything out. That gives us plenty of space again. Now what I've done is I've taken the trimmers, you notice I zip them this way to come down. It cuts the hair short enough for us so we can see where we're going. Once we lock the patient down, I'm going to go ahead and get it trimmed to the level I want. I'll show you the differences. This level here is long enough that you can still pull on it when we try to harvest grass. So we're going to take it down to a little bit of a tighter area. so that the hairs are seen but not in the way. Usually, when you're going up this way, you tend to cut them a lot shorter. You'll see that shortness there coming through. So that will give you the length of hair that you need. Try to do it down once just to make sure I have the right level, and I'll take this over and come all the way through. You'll see little bits of hair coming off, not a lot, not much of a difference. But this now allows you to see the angle that the hair is supposed to cut.
Thank you.
You're welcome very much. Alright, very good. That way the haircut's not so bad, you'll be able to get through this pretty easily. And what we'll do is we'll tape all this down here in a second, and then we'll get you lie down. Alright, just about ready?
Mm-hmm.
Alright, good. Hang up for me right here. You do this. Give me 1 second, I'm gonna put this off to the side because you're gonna be lying on your chest, so. Right, like so. There we go. Alright, go ahead and have a seat on your, go ahead and lie down for me on your stomach.
Okay.
Down and
Okay.
into this position.
And then use your forehead right here.
Okay.
Let's go. We'll finish with the trimmer? Yes, sir.
I'll play with it.
By the way, and join your stomach.
Oh, my stomach.
Do you have a mask?
Yeah, we're good.
Sorry,
One second. I want to double check. Would you hold your camera here? I'll focus on it. That's all. I
Yeah.
just want to see extremely zoom in because that area.
But you're gonna have to come back just a little bit.
Yeah.
Dr. Baby.
Okay. Now it's perfect. Okay. -3. Okay. This is very nice. Okay. Okay.
Okay.
You can zoom in closer,
Yeah.
but don't pan. Everything is
Okay.
already set.
Alright, gotcha.
Yeah, let's do some masks from this side. Everybody's right-handed but you. Alright. Now, Neil, let me need you to tuck your chin down towards your chest. No, the other way. There you go. Yes. That way. Down towards the ground. Come towards me a little bit. Come towards me a little more. I need your forehead right there.
Okay.
Now, come off of your shoulders, so it's going to take a lot of pressure off your body. You can put your hands down by your side here. That's about the best we have for your arms, okay? Alright, good.
It's broken.
Oh, sure. It's plugged in, right?
Yeah? Oh, no.
No, it's just
Just
plugged in.
I'll give you that.
Yeah, it's good.
This is good enough.
Yeah, it's working.
Excuse me.
There we go.
Sure.
That's good. Alright, Mark, let me some tape. Tape some of this up out of the way.
You want some,
Yeah, just regular microcore. Lift your head up for me, Neil. Lift your head up for me. Speak to him in Russian. Спасибо. Здравствуйте. Alright, which way do you go? Levez la tête. That's French. You do French instead? What?
you gonna be generally in that
Are you
spot
using
there?
iodine?
Right here.
Over there?
Yeah, I'm not gonna move.
Okay.
I haven't used iodine.
As far as
Do you?
you.
Iodine?
You're not painting or any.
Iodine, yellow stuff.
Iodine, betadine.
Betadine.
We can, you can't, whatever your
I
choice
never
is.
used it.
Okay. Saline tends to keep the area nice and clean. I tend to find that saline works well. I usually do it just to have it clean, just to do it, but whoever does, some do, some don't. Alright, let's talk about where we're gonna start harvesting. You have a Sharpie? I just dropped mine on the floor, so.
How about an disinfection?
We're gonna do that right now.
Oh, it's
No,
right
left out
here.
here, talk about what
It's
we're
right
doing.
there.
I know it's on the floor and I don't wanna touch it because I don't want to put patients back up here.
Should I get it?
No.
Oh.
You know the one you still around?
Yeah, one that's being extinguished. It's been on the floor, so we can't use it.
Oh, okay. Like they're sterilized?
No, but it's
Well,
not clean because we've
we'll
been stepping.
clean it at the end of the day with one of those wipes and let it sit for a while.
Can I ask you a question?
Sure.
Leon,
Mhm.
the camera appears to be a little hot. Can they put more light on your head?
Aperture is on the lens. There is a ring,
Yep.
and you can turn slightly left, and you will see like it will become a little darker, but just a bit. You will see little lines, for example, like
Yes.
this zebra
Yep.
should be there like 15%.
They should be there.
Yeah,
Okay,
then they'll be
gotcha.
there.
Okay, so doc, anesthesia. We talk about hair transplants. One of the great things about FUE is that it opens up areas that you can't get into with strip. Especially with strip surgeries, typically have stayed to the middle portion of the bone, which you don't really get a chance to get into your inferior portions, your auriculars, your real mastoids, or your auriculars really have obvious. You can, but they're just not as good places. With FUE now we've expanded the donors, so now we can harvest all the way through here. One of the things you'll notice is the positioning of the patient is by far one of the most important things to deal with FUE. You've seen guys do it this way, sitting up, so laying down this way, especially with the contoured handle that comes with the neograph, allows you to work this way. It's a perfect harvest, it makes it a lot easier for you to do it. One of the things we do to make sure, we try to keep it in a flat plane. Okay. So what we're going to do is mark out this mid-occipital region, and that's where we're going to start first. Okay. And then we'll move off into the
So you're
sides.
gonna anesthetize this area.
We're going to anesthetize this area first, then we'll have the patient roll over, and we'll leave this so that it's the same flat. We'll have them on the side, we'll put the patient here, do the other side, do the other side, same thing, okay? Do we have air conditioning in here, because it's already warm? Okay, Leon.
Mhm.
The new anesthesia?
Good eye, yes. Okay, so anesthesia is a little different here. We make our own anesthetic. It is Lidocaine. It's called Blvd. Blvd, are you familiar with it? Okay. Long-lasting, fast-acting, much safer than Marcaine.
Safe for heart.
We love this stuff. We use this across the board for everything, recipient sites and donor. So, anesthesia, let's start right here. You ready? There we go. 1, 2, 3. Not too bad, is it, Neil?
I don't feel anything.
Perfect. So I'm gonna go all the way across and just do one solid ring block. This is Blvd. We mix our own
You
anesthetic.
mean for needles?
We use Blvd, sodium bicarbonate, and epinephrine. The mixture's on the bag. We take a 100 cc bag, and pull out 14 cc's, 12 Lidocaine, 1 epi, 1 bicarb. What that does is allows us to pump the solution with the bicarb, takes away the pinch and the burn from the anesthetic, and then the epinephrine, of course, is used for the basic constriction, as is the Blvd for the anesthetic. Blvd is a long-lasting, fast-acting lighting agent. So yeah, it's a combination, I think, of a Marcaine and lidocaine, because it acts quickly, but also lasts longer. So you get a good 4 to 6 hours of this. Feel okay?
Yes.
You get a good 4 to 6 hours from Lidocaine. It's my preference. We pick this up from a 2-method solution from a plastic surgeon's office. He uses this for his lipos because it's so much safer for lipos than 2 methods. Find that it works perfectly with hair transplants. In the front and in the back, really controls bleeding well, makes hair erosion for us, we don't run into vasovagal responses. I would suggest you don't do this with your strip surgeries. You know, take the same mixture of your surgeries.
They use a combination of lidocaine and Marcaine.
You might say, you experience that you get some vagal responses from patients every once in a blue moon? We never get vagal with this. 5 years, I've never had a vagal response off this medication.
They're lying down too, so you're not gonna see much of it.
Well, same with strips, you tend to vagal whenever they're sitting down or you're placing grafts.
Yeah.
And it's usually in the afternoon.
Right.
You know, so.
Our chairs move. As soon as I see anything that may be suggestive, I put them right.
And Chanel and Burke?
Right.
The old adage is, why do it if you don't need to?
case?
Thank you.
You doing okay?
Mm-hmm.
Maybe all that superficial in the skin.
What's up? Yes. You don't really need to go as deep. You can take really small, TB injections.
It's more painful. The skin is more painful.
At the skin is more painful.
Yeah, well, we plans to face it and come back here and necessary
It's
to
pretty bright,
do.
that's something that
But he said he wanted,
How are you
he
doing
wanted
with
some
the
of
anesthesia?
he wanted
Okay, very good.
One of the great
Lines.
features of sodium bicarbonate buffers is that patient burn. We don't have a lot of that. In fact, if you want to take a syringe and draw some up, you can give yourself a small injection in your hand, and then give an injection of lidocaine alone, and you'll see the difference.
Okay.
I've done them both. I actually have a big scar on the top of my head where I sutured the top of my scalp. You can see it maybe right on top. Didn't feel the anesthetic at all. Absolutely love it. I've not had a transplant procedure, but every one of the patients who has had one has done lidocaine marking. One of the problems with hair transplants is the amount of pain that goes in the anesthesia, dealing with that portion of it. So if you can do away with it by using Blvd instead of lidocaine with a buffered solution, it works perfectly well. So yes, you can do shallow, or what I'm really doing is I'm going pretty shallow. I'm not really that deep. I'm actually staying.
Does it make any difference in the tension if you go a little deep or just go superficial?
No. Hey Mark, can we burn this syringe? I think it's just spitting back at me more than doing anything else.
Okay.
Thank you.
They're coming out through the gasket.
Yeah, it's coming out to the back. Let's burn it. It's awesome.
Yep.
Look at what we have now. Doing okay?
Mm-hmm.
Alright, so anesthesia, same as what you did for your strips. Just do a full ring block all the way to the area. This will just do a full ring. Clean all the way around. The anesthetic doesn't matter how deep you go. To us, it doesn't really matter how deep you go with this portion of it. Whenever you start doing the punches. When you start dealing with your tumescent for punching is completely different. We're going to work on doing tumescent so that it's very superficial. You're going to see the hairs rise, and then superficial, as in a TB test superficial. Okay? So, there we go. Feeling this here?
No.
No pain, right? Anything here?
No, I feel it, but there's no uncomfortable.
Anesthesia you can do however you like. Some people do high and then low, some people do superficial and deep. Just depends what you like. I usually like to go all the way around the corners, finish it out, infiltrate the center, and just let the anesthetic innervate. Give it a couple of minutes, 2 to 5 minutes, so that it actually blanket joint comes all the way through the area. So, once you have your anesthesia on board, for me, I like to have borders set up around so that I don't have to worry about fluid seeping off. With transplants, especially with using the type of tumescent, we tend to have a little bit of overflow off to the sides from using our tumescent. We put it so shallow that it will come through the skin. You see a little bit of leaking from the fluid. Not a big concern. It's one of the reasons why we have that bottle. Like I said, we're only going to end up with maybe this much fluid. It's not that much, but it keeps you from having a technician or someone here running around trying to keep up with keeping your field clean or catching any runoff. Okay. And then we'll do the same thing when we get to the other side. We'll take the same area out so that it has nice area to control. Now we have prep surgical area. We're ready to run. Mark, right behind you, or Dr. Dave, there are 0.8mm punches that are sharp. May I have one, please?
to your right in the white bag with the big label. Go put your hand down on to your left. There you go.
Getting one free hand so I can grab this. So then I can just use it up. I have 12 hands. Just to show you as well. By doing that, I have a free hand that I can do what I want. I can touch it talk about doing is having suction bars going all the way through. We can see and check the gauges on your machine. Like we talked about rotations and revolutions, come all the way up to 6,000. By pushing on your green pedal, controls the rotation of your punch. We can control the revolutions with this dial here. Alright, this is your guide. This will actually tell us what we were talking about before. How are you going to tell the skin? Different skin has different levels of speed. We're usually somewhere around 200 to 500, 600, somewhere in there. Alright, depending on the person. Thicker skin, fibrotic tissue, of course, has more issues. Just regular patients like this here, brandy, wide open donor, is usually somewhere around 200, 250. We'll start them at about 225, and start from there. Alright? Now, when we're dealing with this, I like to have the most amount of suction that we can. Notice here is your vacuum bar. Your vacuum bar tells you what level of suction you're at right now. There's an adjustment on the back. There's a small dial back here. That's a black dial. You can take, turn it, turn to the right. Right turns up the increase. Turn to the left, it decreases. Okay? Once it's set, pull it back and it's ready to go. Now we're going to take your punch.
What is normal restriction in use?
The normal one?
Yeah, you just
You can keep
standard
going from there.
restriction in use.
You're good.
Usually you can go up and down, right?
Mhm.
So which one is the level that you use?
With harvest, I take it as high as we can. I take it to the maximum level. You want to be able to keep it somewhere around, you'll find your bar will come in somewhere around 650 to 750. Perfect. Whenever you notice that it comes all the way up, that means that there's a clog in the line somewhere and that you have maximum pressure because there's no pressure coming through, there's no air coming through the line. By releasing it, letting go, you'll actually see if there is a clog, your bar will come back down. Alright? Right there.
Sharp.
Yes, sir. Thank you. Alright. Here's your two big sharp punch. Right behind you, I think. Sharp punch. We'll actually work on this with you guys here in just a second. Good. This, we talked about before, has little ratchets at the back of the tip. The back of the tip has the ratchets that actually allow it to lock in. It becomes a locking mechanism so they don't come out. There's a spring-loaded locking mechanism in here. Push down on the back, as you hold the ankle in your hand, press down on the back, insert it gently. You don't need to force it. It's not a forceful thing. Rotate it back and forth and just kind of wiggle it. You'll feel it click. When it clicks, now it's actually solid. Now we've been able to complete the system all the way through. From here. Never?
Yeah.
Yeah. You seen the cap of the old ones?
Yeah, I saw the other one.
The great thing about the old one over the
Yeah,
new
yeah.
is we have the rotations. We can control rotation speed. We can control suction speed. Placement handles are a lot smaller and more contoured. They fit better. And then the handle for the placement is far better with this contour placement harvesting tool. Far more comfortable. The older one was a big round one that you had to use like this, and it just isn't that comfortable. But this, for ergonomics, works perfectly.
Yeah.
So now, we talked about doing sharp and dull first. We're going to teach you guys about a 3-step technique. Inside your packages come the silicone tubing. The way that we started using the silicone tubing is by taking it here and attaching it to the punch. Notice that it actually holds pretty well here. Okay? It fits these punches perfectly, so what we're going to do is cut this back and use it as the depth control. This way the punch can only go to the point of where we prescribe. Wherever you cut it is where we're going to start. Now, epithelial tissue, going through the first, we learned that it is essentially right about the bevel. You don't really need much more than the bevel to go through the skin for us to follow up with a blunt dull punch to go underneath and harvest. So, take a pair of tenotomies or whatever kind of scissors you want to use. I like the tenotomies because they're small and precise enough to do what we're doing here. Take that, actually take your grab. When you take and mark this line, if we pull on the tubing and cut at the same time, it creates a little bit of a bend in the tubing. What that does is allows us, notice how this slides a little more? It allows it to kind of snug and hold on a little better. Okay? So now it holds a little better. The punch, the depth control will not fall off this way. You can do whatever you want. You can move it around. It will not fall. Because once we set this depth, you don't want to try and set it again. Okay? Do we have a razor blade or a 11 blade or anything along those lines?
Single persona.
Yeah, single persona, anything? What do you guys cut with as far as anything?
15.
You guys cut not the surgery, not the strip, but the grafts. What do you guys cut grafts with?
15. Yeah.
Guys are 15s?
Or 10,
Okay.
yeah, 10 persona, yeah.
Okay. I just need something sharp that we can shave with.
So 10 is okay?
Perfect.
What is other? But it's not persona.
back just a little bit with the 11 blade. The 11 blade comes in and just shaves off a small portion so that you can make it even. You want to shave down this area to take away any cuts in the plastic to avoid abrasions to the skin. If you have this punch, you have this tubing, it's actually rolling against the punch, but rolling against the skin, it can cause abrasions around the outside and you see small circles. So by taking your razor blade or taking an 11 blade, 10 blade, whatever it is you want to use, you can come here and slowly just peel back the top layers of the plastic. It makes it smooth and takes away any jagged edges. So now you can feel and see that that's a far better edge that won't cause problems. Now, this is also how you're going to gauge your depth. What we're going to do now is I'm going to go first do a test punch. Find out if my depth is, I'm going to do 2 to 3 tests to find out if the depth is deep enough for us to take a double punch to go all the way through the skin. The test works like so. Alright, we're pretty good about setup? Yeah. Alright, good. Use saline. 2 nose plates. Now, we have 2 different syringes on the plate. We're going to do 2 different syringes on... We have 2 different syringes on the... Is that going to give me a shadow or no? We're good. Alright. 2 different syringes. One is for anesthetic, and the other is just for normal saline tumescent. Okay? We talked about tumescence and FUE. Some people say no, I say absolutely yes. And the reason is because these hairs here, if you try to take the punch, dimple. As soon as you put it to the skin, the hairs dimple underneath the skin. So what we need to do is add turgor. You feel any of this? You doing okay?
No.
No pain, right?
No.
Good. Now what you notice is it's very superficial, almost like a TB injection. Okay? This is a bee sting shot, just a small, it's very superficial injection. Notice how the hairs stand up for you. Now you can actually tell the difference in turgor. The difference here compared to here.
It's
It's actually intraepithelial. It's not even intradermal or subdermal. It's intraepithelial. It's actually
very superficial.
very, and you can almost see. You actually, to work on it is to go bevel up and work on taking care of the first 2 to 3 millimeters of the tissue. You want that because now we're talking about hairs here. You want that because when we talk about your hair follicles here, as they stand up, now we have turgor here. When you take that punch, now that the punch can push through the tissue without the hair really bending. Each time your tumescent dissipates, then you replace and you do tumescent again. Alright? So there's one. Tumescent first. Alright? Take the rotation of your punch. We have it about 275 right now. Find your graft. Now you get counter pressure on the tissue to make sure nothing moves. Put it over here. 1, 2. Notice how the punch just about stops right at the skin. You want it to stop so that it no longer continues to rotate. And that's how you gauge yourself. We talked about trying to go for speeds earlier, Doc. So we were at 275. A small depth for setting a depth control for your dull punch. What I'm doing, I have a little bit of a curl to it. It's interesting. Instead of setting, we're gonna get to a point where we have a depth control punch for your dull also. And instead of sitting here and spending 5 minutes trying to set it, I just want to make sure that the blunt will go through. Once the blunt does go through the skin and it works as well, then we know that the depth is set on the sharp punch, and that's what we're looking for right now. Once we have the depth of the sharp punch, which we do now, we know we're set. Now it's just a matter of going back through and punching a bunch of sharp depths. Come back and follow up with a depth control blunt, and we'll do the same thing. We'll test the depth of the blunt by how well the hairs release out of the skin. Okay. So sharp is there. So hair look. I'm gonna switch up my shirt.
So it's only designed for micro blunts?
Yes.
Only.
Only. Unless you want to start using larger 1.5s or 1.4s, you have you only have 1.8s. You don't want to start using larger punches on these. Anything bigger than a 0.8.
3/4 sometimes, you need for density.
I understand, but you're talking about doing 3 or 4 hair grafts with this procedure. You can pull them with 0.8s. You don't have to pull it as a strip, and you don't have to do 2 units together for mini grafts. You can do micro grafts. Can I have the unit too?
You should have had it. I'm not gonna pass it off.
That's good. Okay. Thank you. That's right. We're still getting teas. I want to go a little shallow. The reason I keep going a little more shallow is because I keep having a transaction underneath. So if we know that like his hair has a little bit of a curl to it, it's a little bend, which is it's throwing me off. With that little bend now, we know that we're going all the way through, we're having no issues. So let's go ahead and take it back a little shallow. Even where we were on this one, take a look. We're probably about 2.5 millimeters in.
Go to the mark, those shells,
Syringe.
Yeah, I know. Oh, that's
negative
why I
pressure
pointed the needle in, so
Okay.
you get it in the
Okay.
machine.
Okay.
I hit it with that one.
And then when you use the,
Do you want me to
we'll
toss
use the
it?
double punch the same
Yeah.
way. We'll use the least amount of depth for the sharp, although for a larger or
I'm not
more
sure where the
depth
sharp's
for
gonna
the
go.
dull, you go actually down towards the base of the graft. I'm gonna cut this one a little more up towards the base, or towards the tip here. There we
Yeah.
go. Let's go, this side.
Ian, are you sleeping?
Not yet.
You want some water?
No, I don't want.
Vodka?
Vodka.
An IV of vodka would be good, huh?
Oh, yeah.
Alright, so the first two I was too deep, so I'm gonna go this one a little too shallow. I'm gonna purposely dial this one back as opposed to trying to guess and jump in right away. So, guys. All I'm doing is just centering the graft right on the punch, and going right at the same angle that I'm seeing. Notice how the hair angles are turning this way from on this side of the head. So I'll position my body the same way. We want to go at a perpendicular angle. We want to be perpendicular to your shoulders. Makes it far easier to harvest. Assuming he's going to be a little shallow. Alright.
So I think basically with this machine you can take even from your chest because there is no scar. It's just
Well,
perfect.
Yeah.
Some people asking.
Benefit of the 0.8
Really?
punch is that you can do this without any
Master.
punch.
Mm-hmm.
Notice how the punch does go through. This is a much better punch.
That's the double, is that the double?
This is the double one. Now that graft I just pulled all the way through.
Eyebrows. You know, like tiny
Matching
scar.
eyebrows.
Yeah. Yeah, that's perfect.
Yeah, we talked about harvesting and using them for the reservoir. There's kinds of things we want there. Of course, I put these. Because you get bigger than I'm looking for these. Now, yeah, so the spray on this. So I got some spray on the back of my finger here, Mark. I'll show you what we do with this. Alright, so now I'm pulling these grafts out. Thank you. Now we're taking ours and using the little graft and pulling it all the way through. There's your graft. There's your graft. So we have the depth set, we have the right angles, we know exactly where we're going with our sharp. Now we can go back and do our mill. Okay? Makes sense? Now, to harvest these and pull them all the way through and to bring them all the way in, you've got to be able to stop every 10 minutes or so, every 10 grafts or so. Taking them out and redoing them really costs you time. It's sort of like taking the same one graft. Exactly. So, by doing that, we take those, and put those over there. Now we have the depth for the sharp, for the dull punch that, or sharp punch. You see the difference between those and these? These are not dull punch. And you can see the difference between the ones that have been dull and those ones that have been sharp. This one has just been sharp, it's just to the epithelium, it doesn't release. Once you dull punch, the hairs will end up releasing all the way through. Alright. So we take sharp punch mark. We're going to do 25 grafts. I'll let you guys start doing the same thing, okay? Here's this one.
Is it harder when density is high? It's easier when it's.
You get more hair when the densities are high. Just because you have a higher level of density, you can harvest more grass per tumescent. So right now we'll usually harvest somewhere between 5 to 12 grass per tumescent dissipates. With higher densities, it's fascinating. We're just gonna keep going.
That's great.
When you have higher levels of density, so someone who has 85, 90, 95 graphs per square compared to someone who has 60 per square or 70 per square, obviously.
Patient has maybe more adult. So took him 1 second and we were off doing the rest. This gentleman, so it's a little, has a little different, not off maybe typical. So it's taking a little longer.
It's important
Once
thing for this.
he gets it, we just go down.
So how long it took for you just to do perfection?
I've been working on this for 8 years.
On this machine?
FUA for 8 years. I've been on this machine for a year and a half.
Also you were doing singular extraction?
Vegetable?
Oh yeah? 8 years? Oh, that's cool.
Started back in 2000.
You'll be okay in 2018.
Where will we be doing? Stay a little tight. Stay a little tight. I'm purposely going a little slower on this because I jumped ahead of myself a little earlier. Still not done. That's okay. These are all still great viable grass. Just have to keep dialing back until we find the spot. Once you find the spot, then we'll push through the entire area.
You want another plate? Was it sharp enough?
We don't really feel it, so we're not really pulling a whole lot of.
It's just a variation.
Actually, you want them together?
Always been like that. See?
Is it wet? Yeah.
Feel that?
No.
Did they work?
Feel anything here?
We need some surgery.
How about over here? Feel anything here?
None of that.
Not by sure. No, you can feel touch, but you
Yeah.
shouldn't feel pain. We'll just give you
Just a little.
nothing up there.
Just a little.
That's where
I feel
we're just freezing.
Oh, it's the heads of floor.
Mm-hmm. Just garbage?
You'll let me know if you feel anything.
Sure.
Okay?
Yeah, these surgeons are
Sorry.